A 55-year-old patient undergoes a bronchoscopy for chronic cough, and a biopsy of the tracheal lining is obtained. Microscopic examination reveals epithelium that appears stratified, but has all cells resting on the basement membrane, with nuclei at different levels. What type of epithelium is this? Pseudostratified epithelium appears stratified because nuclei are at different levels, but all cells rest on the basement membrane. This is the classic description of respiratory epithelium lining the trachea and bronchi. A bladder biopsy from a 70-year-old patient with hematuria shows epithelial cells that appear cuboidal when the bladder is empty, but flatten when the bladder is distended. This epithelium is specialized to accommodate stretching. What is it called? Transitional epithelium, urothelium, lines the urinary tract, from the renal calyces to the proximal urethra. Unique characteristic of this type is the ability to stretch and recoil. With change in aperonase of cells, they have specialized umbrella cells. A bone biopsy is examined under polarized light microscopy. The organic matrix shows highly organized fibers. Which type of collagen is predominantly responsible for this finding in bone? Organic matrix of bone is composed primarily of type 1 collagen, which provides tensile strength and forms the scaffold for mineralization. The organic matrix shows strong birefringence due to highly organized fibers. During an autopsy, the pathologist identifies the largest lymphoid organ in the body. It is located in the left upper quadrant of the abdomen and contains both red pulp and white pulp. Which organ is this? The spleen is a lymphoid organ, enclosed in a fibroelastic capsule, containing red and white pulp supported by a reticular network. It lacks cortex and medulla differentiation. A 12-year-old child undergoes chest CT scan, which reveals a belobed organ in the superior mediastinum. This organ is large during childhood, but undergoes involution after puberty, being replaced by adipose tissue. Which lymphoid organ is this? The thymus is a specialized primary lymphoid organ, consisting of two lobes, enclosed in a capsule, and divided into lobules by connective tissue septa or trabeculae. Each lobule features a darkly staining, lymphocyte-rich cortex, and a lighter medulla. A cross-section through the mediastinum shows a structure with 16 to 20 C-shaped rings of hyaline cartilage that maintain patency. The posterior wall lacks cartilage and contains smooth muscle. What structure is this? The trachea is a fibrocartilaginous tube characterized by 4 distinct layers: mucosa, submucosa, hyaline cartilage, and adventitia. It is lined with pseudostratified ciliated columnar epithelium with mucus-secreting goblet cells and a thick basement membrane. A lung biopsy shows a structure lined by simple cuboidal epithelium, with prominent smooth muscle in its wall, and a notable absence of cartilage. This structure is part of the conducting portion, but represents the last segment before gas exchange begins. What is it? The bronchioles are lined by simple columnar to the cuboidal epithelium, and the alveoli possess a lining of thin squamous epithelium that allows for gas exchange. A duodenal biopsy reveals glands in the submucosa that secrete alkaline mucus to neutralize acidic chyme from the stomach. These are characteristic of the duodenum and distinguish it from other small intestinal regions. What are these glands called? Brunner's glands are characteristic features of the duodenum, located in the submucosa with compound tubular or tubuloalveolar glands, with clear, mucin-filled cells. A gastric biopsy shows cells located in the gastric glands that secrete somatostatin, which inhibits gastrin release and regulates acid secretion. Which cells are these? Delta cells are endocrine cells, found in the gastric mucosa, primarily in the pyloric region, that secrete somatostatin, inhibits release of gastrin from G cells, reducing acid secretion. A histology slide shows circular structures, with concentric lamellae, surrounding a central canal containing blood vessels. These structures are found in compact bone. What is this basic structural unit called? The osteon, or Havasian system. Is the fundamental functional unit of compact bone. Structure includes central canal that contains blood vessels, nerves, and loose connective tissue.